What's up, fellow watchdogs? It's Sean Henry here again from Media Windog Winnipeg and also Winnipeg Alternative Media. It's time for another video. We're just going to jump right into it. This is going to be a follow-up video, like a direct, immediate follow-up and response to the last video that I posted regarding CTV News Winnipeg's interview with former Manitoba Chief Medical and Public Health Officer Dr. Joel Kettner last week. So if you want to watch the original interview that Dr. Joel did with CTV News, you can go and look at my YouTube channel, Media Windog Winnipeg, and you will find the video there. It's something titled along the lines of like CTV News Winnipeg is up to some shenanigans. And the shenanigans that they were up to is an even bigger news story as far as I'm concerned than the interview that they did with Dr. Joel himself. There was a lot of really important, relevant, not usually readily available information talked about in the original interview with Dr. Joel, but an even bigger story and event surrounding that interview was the way that CTV handled the information after the fact. Just as a quick, brief recap for people who may not have caught it. And again, if you want to watch the full interview, go and check out the last YouTube video that I posted. CTV News Winnipeg is up to some shenanigans or something along those lines. But CTV News brought Dr. Joel Kettner in last week for an interview, and then towards the end of his interview, very abruptly and pretty rudely cut him off because they, quote, ran out of time. It's only Manitoba's former Chief Medical and Public Health Officer coming on to talk about the ongoing COVID-19 pandemic. It's not important. We can just cut him short and move into our next segment because we ran short on time. And it looked like it was a weather update that they were going into. I could be wrong about that. And then after that interview was so abruptly and rudely ended, and they cut Dr. Joel off kind of mid-sentence. They had posted that video initially, and then people were causing a big stink about the way that they cut him off and ended the segment short. And then CTV deleted the video, edited the video so that it cuts out the bit about them, cuts out the bit at the very end of them cutting Dr. Joel off and ending his segment early because they ran out of time, and then re-uploaded the edited video, seemingly hoping that no one would notice. And that caused even more of an outrage than the original interview did itself. So again, to kind of get a full idea and a full picture of what happened with the original CTV News interview with Dr. Joel Kettner, go back and check out my last YouTube video, CTV News Winnipeg Up to Some Shenanigans. And the links to the full interview are in the video description, both the originally uploaded version and the edited and re-uploaded version. So go and check those out and you will get to see how CTV News handled the first interview that they did with Dr. Joel last week. Now today, we are going to be reviewing and reacting to this new interview that CTV News did with Dr. Joel Kettner just yesterday. Dr. Joel Kettner was asked back onto CTV News again for a second time to kind of redo the interview and get another chance at actually having his full and proper say. And I obviously can't say this with any degree of certainty, and CTV News Winnipeg would obviously never admit this to anybody, but I have this weird feeling, and I would almost be willing to bet that this second new interview, this better interview with Dr. Joel, probably wouldn't have happened had such a fuss and such a stink been raised had such a fuss and a stink not been raised over how they handled the first interview. So kudos to everyone who caught the edit job and the re-upload that CTV did with the original interview and held their feet to the fire over it and made them aware that we were aware of what they were doing. Because again, I feel like, and there's no way that I can prove this, but I feel like that is a big part of the reason, if not the big reason, that this new, better interview with Dr. Joel got uploaded today. So, moving ahead here, we are going to go through this 7.5 minute long interview between CTV News Winnipeg and Dr. Joel together. We're just going to watch it. We're going to let Dr. Joel talk, and we're going to watch the interview, and I'm just going to kind of jump in from time to time and give a little bit of additional context and my thoughts and feelings, and then we'll kind of talk a bit longer at the end, and we'll wrap it up there. So let's start to watch the video. And Again, go and watch the last video I did on this subject, and then watch this video with this interview, and you will notice just the night and day difference in the quality overall of how the interview is conducted just in general. So let's go.
Last week, we were joined by Manitoba's former Chief Public Health Officer, Dr. Joel Kettner, to share his analysis on the government's response to the COVID-19 pandemic. However, we ran out of time in that interview, and in light of this and new Code Red restrictions here in our province, we thought it timely to have him back.
Yeah, because of the fact that you ran out of time with his initial segment, and because of the new Code Red restrictions, which had already been announced at the time, you brought him back on for another interview. I'm sure it had nothing to do with the nonstop angry phone calls, emails, Facebook messages, and text messages that your organization and your outlet was getting all weekend over how you handled the initial interview. I'm sure that had nothing to do with your decision to bring him back on and do a second interview, but whatever. Again, there's no way they would ever admit that. There's no way that I can prove that, but I feel like that's one of the reasons they brought Dr. Joel back on to do an interview again.
Dr. Kettner, thanks for joining us once again.
You're welcome.
So, Dr. Kettner, we're officially entering Code Red in Winnipeg this morning, which means further restrictions to businesses and calls from the government to limit our close contacts. So do you think this will be an effective way of slowing the spread of COVID-19?
Well, I think that it'll have some effect. It's hard to know how much effect it will have or for how long it will have an effect. And that's very difficult to predict. We do have some observations of, what happened in our earlier in the spring and how long that may have been working for. But in other countries also, these things seem to work for a while, and that this virus, reemerges. That's what respiratory viruses do.
That's what respiratory viruses do, Dr. Joel says. So similar to the seasonal flu, which just keep that in mind, because over the course of this 7.5 minutes, Dr. Joel directly or indirectly compares COVID-19 to the flu, like I believe 3 or 4 times. So let's keep a count on that. We're already at 1. And as he was saying, like the seasonal flu, with like many respiratory, if not all respiratory viruses, you take these precautionary measures and you take these precautionary steps to try to get a handle on it. And they work for a while, and then the virus reemerges and starts to infect people again. That's just how they work, according to Dr. Joel, whether it be the flu or whether it be COVID-19. So we don't know how effective these methods and these restrictions and these rules and these lockdowns and whatever else are going to be, or whether they're going to be effective at all.
The approach our government is taking, some have called a restrictive approach to...
That's putting it mildly. I would say authoritarian, draconian, tyrannical, borderline dictatorial, but yeah, restrictive is also a good word for it, I guess.
To try and stop transmission, but you say there's another option that maybe we should be considering. Will you explain this a little bit?
I think there's many options on a continuum. The first question is, what are we trying to achieve? What are the goals of our strategies? And I think most people, understand, and the communications have been pretty good.
Disagree, but whatever, go on.
That there are really 3 main goals. One is to prevent severe infection, especially premature deaths and hospitalizations. And that's the second goal, is to try to reduce too much pressure on our health system, especially our hospitals and our intensive care units. But the third goal, like all treatments, whether it's treatment or prevention, is to minimize the harms, unintended perhaps, well, certainly unintended, of these interventions. So I
love that he goes, yeah, we have to be more mindful of the unintended side effects and consequences of the COVID-19 pandemic, and as well as the interventions, he calls them, to the COVID-19 pandemic. So basically, to me at least, and you guys interpret this however you want, to me, Dr. Joel is really very nicely and very subtly saying, we not only need to consider how these restrictions and rules are going to affect the virus, but we need to consider how these rules and restrictions are going to affect, everything else as well, like the economy, the job market, people's overall health and well-being and mental sanity. That's how I interpreted that. You guys, like I said, watch this video for yourself and interpret it however you will, but that's how I heard what that's what my brain told me that Dr. Joel just said, is that not only do we need to be more mindful and put more thought into whether or not these restrictions and rules are going to have any effect on the virus and the pandemic itself, but we need to consider whether these rules and restrictions and whatever else are going to have an effect on, every other aspect of life as well.
Given that, an approach that I think is being increasingly discussed and debated is to be a little bit concerned about the total number of cases.
So I've watched this video a few times and I realize the audio cuts out there. I believe what Dr. Joel is saying is they need to be a little less concerned with the total number of cases.
Most of which, and increasingly of which, are in younger and healthier people with very little severity and very little need for hospitalization.
So most of the new cases of COVID-19 are in younger populations who need little treatment and less hospitalization.
To really focus more on how we can better protect those at higher risk.
What a novel fucking idea. We focus more of our time and effort on protecting the people that are actually at risk. What a crazy concept. You conspiracy theorist, you, Dr. Joel.
And we know increasingly who they are.
We've known for months at this point who the at-risk populations are.
People who are elderly. Most of our deaths have been in personal care homes, people with other health conditions.
So according to Dr. Joel in the original CTV News interview that he did, around 80% of our total deaths in Canada from COVID-19 have been in people 85 years of age or older. So that's like 10% of the population of the country. So the vast majority of deaths in Canada from COVID-19 are taking place in the 70-plus age group, and the 70-plus age group only makes up 15% of the total population, which means that the other 85% of the population of the country has little to nothing to worry about in terms of risk from COVID-19. So why are we just blindly, blanketly, cookie-cutter approach telling everyone, 100% of the population, how they have to handle things, instead of being much more focused and concentrated on protecting the small percentage and small portion of the population that we actually know are at risk from the virus?
Chronic diseases, immune system weakness, and there's good evidence now, I think, and I think we have evidence in Manitoba and other parts of Canada that the hospitalization, although increasing somewhat, the deaths are really, compared to the number of new cases, the rates are actually in some ways getting lower.
Everybody stop and really process for a second what Dr. Kettner just said. So he said that in Manitoba and in other places in Canada, and likely in other places around the world, while cases and hospitalizations and deaths are all on the rise in total, if you look at the increasing number of deaths compared to the increasing number of cases and hospitalizations, the overall severity and mortality of these COVID-19 cases is still going down. This is the exact same thing that we saw with the total number of cases earlier in the year. This is the same problem that we had where the media spent weeks, if not months, focusing exclusively on the total number of COVID-19 cases in Canada, in Manitoba, in Winnipeg, disregarding almost entirely the number of active cases, the number of recovered cases. Sorry about the dog barking in the background. And it's the exact same thing that's happening right now in the media with the deaths. The media is throwing the increasing total death count in people's faces nonstop, making them think that, oh, this disease is getting so much more severe as time goes on. But if you look at the increasing number of total deaths compared to the increasing number of total cases, like Dr. Joel said, and like I just said, the overall severity and mortality of COVID-19 is still going down despite the increasing number of cases and hospitalizations.
And so if we could do a better job, I think we could, of making sure people know who's at higher risk.
We know who's at higher risk. You said so yourself just a few minutes ago in the same interview, but whatever.
And finding ways to protect them, I think that not only would we have reduced severity of disease, but we'd have less pressure on our hospital systems.
So what he's saying is if we do a better job, and to me at this point that means doing anything at all to actually protect our at-risk groups and populations, then we would not only see a reduced severity in the overall disease and pandemic itself, we would see a greatly reduced strain on our healthcare system, which was already in really fucking rough shape to begin with before the COVID-19 pandemic even hit, thanks to Brian Pallister. And just a few, I mean, there's other factors besides just Pallister being the premier, but I mean, Pallister is one of his big claims to fame recently is that he's cutting healthcare all the time and closing down ERs and all that fun stuff. So, like I said, our healthcare system was already no great shakes when this pandemic kicked off. So Dr. Joel is saying if we do a better job of protecting the at-risk population, which again to me means if we did anything at all to protect the at-risk population, we could reduce the strain and severity of both the virus and the pandemic overall, but specifically in our healthcare system.
So in terms of protecting those at a higher risk of having fatal outcomes from COVID, the rest of the population, those seemingly healthy Canadians,
which again is 85 to 90% of the total population of the country,
how would they be living amidst COVID-19?
That's a really good question. So how do we see the not at risk or the less at risk groups living their life ongoing during the COVID-19 pandemic if we were to do a better job of protecting the actual at risk groups and people? That's a really good question. Kudos to CTV News where it is due, and kudos to this interviewer where it is due. Like I was saying earlier, the difference between this interview and the first interview that they did with Dr. Joel is literally night and day. This is actually a good interview, so props to CTV News where it is due. They're asking good questions, it's a good interview, and the best part of all is that after they're done asking the questions, they're just shutting up and letting Dr. Joel answer.
Well, I think that's a good question, and there's many ways to do this, and I don't claim to have the perfect right answer, but I would like there to be more discussion and debate about this.
Amen.
I think there's probably reasonable logic to say let's try to lessen restrictions for those who we're less worried about having severe disease,
which again is 85 to 90% of the population.
Such as schools and workplaces and businesses and restaurants,
i.e. pretty much everywhere except for healthcare facilities and care homes.
And well, the list goes on, and everybody knows what they are. Let's, for example, support people at higher risk to not go to work and to be compensated for that. If people need help in their homes to protect their elderly or frail parents or grandparents, find ways to provide support so that can happen. I think there's many ways that we could increase sort of normality of everyday life in society and be more focused on protecting those who are at high risk.
So he is saying that it is not only possible, but very realistic, borderline going to be actually pretty easy to do a better job of actually, again, protecting the people that need to be protected and letting everyone else go back to living their lives a bit more and easing restrictions on the people that aren't really at risk, which again is 85 to 90% of the total population. You can go and fact check this. You can go and fact check me on this and look this up for yourself. But if you go and look at the demographics of your city, your province, your country by age, I'd be willing to bet that the 70 plus age group, which again is the most at risk group of people, only makes up about 15, maybe maximum 18% of your population. So 82 or 83 to 85% of the population are in the low at risk or not at risk category.
So, Dr.
I mean, I think, Go ahead.
Oh, I was just going to say,
more focused on protecting those who are at high risk.
So, Dr.
I mean, I think, go ahead.
Oh, I was just going to say, if somebody...
He's so polite, too. That's one of my other favorite things, is like, this dude has every reason to be just as livid as the rest of us, but he is just being so calm and cool and collected and polite. I love it so much.
Who is seemingly at low risk for the disease or the virus rather, and is passing it around. Are there any concerns that if we can track them, that we just don't know what the long-term effects are from COVID, because of course it's new, we just don't know what that'll look like on the body?
Another really good question.
Well, that's an important question. It's very hard to predict long-term future of many things, including what would happen with the vaccine, or long-term consequences of the social, economic, educational impacts of these restrictions.
That's something that conspiracy theorists like myself have been screaming about for months, is what are going to be the non-virus and non-pandemic related side effects from these restrictions? What are going to be the economic effects, the mental health effects, the financial effects, the unemployment effects, the business market effects, the job market effects? Like, what are all these other side effects of these restrictions and rules and lockdowns going to be? We should have been asking these questions all along and having these discussions all along, but we're 8.5 months in, and we're leaving it up to our former chief medical and public health officer to ask these questions.
But from what we're seeing, there aren't a lot of signals that there's a high rate of sequelae or complications of COVID-19. Similarly to most respiratory virus infections like influenza,
So he's saying that while, yes, there are instances and cases of people having severe long-term negative effects of being infected with COVID-19, those cases are few and far between, similar to other respiratory viruses like the flu. Again, I told you to keep track, and I think that's number 2 or maybe even number 3 of instances over the course of this brief 7.5-minute interview where Dr. Joel directly or indirectly compares COVID-19 to the flu. But what he's saying is that these cases of severe long-term lasting negative effects from COVID-19 are few and far between, which is very interesting because for a couple of weeks there, and you guys may have noticed the same thing, I was seeing story after story after story of this woman in her 40s and this man in his 50s and this man in his 30s who are otherwise perfectly fit and healthy have been suffering from the negative health effects of COVID-19 for 6 months, 7 months, whatever, blah, blah, blah. And it's giving this skewed perspective and skewed view of how common and how prevalent these long-term lasting negative health effects are. But according to Dr. Joel here, similar to the seasonal flu, COVID-19 cases with severe long-term lasting negative health effects are pretty few and far between.
Yes, there's effects on the heart, on the nervous system, and other types of side effects. How long they will last, how severe they are, we need to learn more about that. But I think that from what we know about acute respiratory viruses, it's likely that these long-term effects are not going to be very, very frequent or severe. But let's also ask the question, what is the long-term expectations of the virus circulating? Because most people say this is going to go on for a long time and maybe recur every flu season. So,
i.e., we're going to have to learn to live with it because it's going to be around for a while. So hopefully that doesn't mean that we're going to keep playing this lockdown restrictions, stay inside, wear a mask dance game for the rest of time. But hopefully what that means is that people are eventually going to just start treating this much more like the regular flu than a world-ending virus and pandemic.
Maybe eventually most of us are going to get infected one way or another. And so, we have to put in perspective, what is our ability as a human host and in society to really stop the spread of this virus? It's a challenge. We haven't been able to do it with influenza.
I believe that's number 4 of indirectly comparing COVID-19 to the flu. And again, he's saying the notion and the idea of being able to stop or eliminate one of these respiratory viruses is just patently and wholly unrealistic, because we haven't been able to do it with the flu. So what makes people think we're going to be able to do it with COVID-19, which is also a respiratory virus and behaves very similarly?
And in many ways, it looks like the seriousness of influenza, especially for younger people and children, is greater than what we're observing for this coronavirus.
So the regular seasonal flu is more dangerous and more severe to younger people than the COVID-19 pandemic. So both the flu and COVID-19 are definitely risky and severe potential issues that the elderly population has to face. But unlike COVID-19, the flu also seems to more severely affect younger people and children. So if we don't lock down society every single flu season to protect something that affects children as well as the elderly, why are we shutting down society across the globe for something that affects the elderly but not children? Like, it just doesn't make any sense. We're going to watch the end of this interview here. There's only about 15 seconds left. This, by the way, is how you are supposed to end an interview with Manitoba's former chief medical officer.
Well, Dr. Kettner, we're going to have to leave it there. Thank you so much for joining us this morning, and again for sharing your time with us. Dr. Kettner? I think we've lost him, but thank you so much again for your time, Dr. Kettner.
He would have a really spotty internet connection too. He just seems like the type of guy that would just have just the bare bones minimum internet connection of like, I just need enough to make sure that my phone and my TV works every month. I don't need to be doing these stupid Zoom calls. It's just funny that he has like a really spotty internet connection that's been kind of giving out and cutting out the whole time, because he totally strikes me as that type of guy. So I thought that was just perfectly appropriate and hilarious. So yeah, that is what an interview with former chief medical and public health officers are supposed to look like. Like I said, kudos to CTV where it is due, and kudos to this interviewer where it is due. There were a lot of really good questions asked. It was a very civil, well-done interview that was very just all around, very nice, very calm, collected, cool demeanor. And the best part, as I was saying, is once they were done asking the question, the interviewer actually just shut up and let Dr. Joel talk and answer. So now, again, I'm going to once again, before I wrap up here, encourage people to go back and look at my previous YouTube video that I posted just a day or two ago. That is, this video is like a follow-up to that. I guess is, you could consider that video from a couple of days ago like the prequel, I guess, to this video. And you can watch the difference in how the first interview with Dr. Joel went versus how the second interview with Dr. Joel went. You can watch the YouTube video that I posted to I'll do a breakdown of the differences between the originally uploaded version and the re-uploaded version of the first interview that they did with Dr. Joel. But then in the description of that video is links to the full interview, the full first interview that Dr. Joel did with CTV News. So go to that video, go to the description, and watch the full first interview that Dr. Joel did with CTV News, and then watch this video and see for yourself the difference in how the interview was conducted. And again, I want to thank everyone and give props to everyone who caught the edit and re-upload job that CTV did on the original interview, because I feel like, again, without any way of being able to prove this or without anyone ever admitting this, I feel like, and I suspect that this new, better interview with Dr. Joel would not have potentially even happened in the first place had such a big outcry not been raised surrounding the first interview. So thank you to everyone for holding CTV News' feet to the fire and keeping them accountable, because that is one of the things that I believe resulted in us getting this newer, better interview with Dr. Joel Kettner. So I'm going to wrap this video up here. Thank you all for watching. I hope you enjoyed it. If you did, please leave a like, leave a comment to let me know what you think of the job that I did. Go to my channel, subscribe, hit the notification bell so you get notified when I upload new content, all that good shit. And we'll talk to you guys soon for another video. Ciao, ciao.